or the Before we get started today, I have just a few housekeeping items to go over. Firstly, we are delighted to have so many new people join the call today, along with our existing members. For those of you who may not be as familiar, we are the Wisconsin Cancer Collaborative, Wisconsin's statewide comprehensive cancer coalition comprised of 140 organizations working together to reduce the burden of cancer for everyone in Wisconsin. If you are not yet a member, we'd love to have you join. Membership is free. If you're interested in joining, you can do so at the link on the screen. And secondly, for those who are members, it's time for membership renewal. Yesterday, an email went out with instructions on how to renew your membership. It's easy and quick to do. This year, we are asking all members to add a few new pieces of information to your profile, including your Wisconsin Cancer Plan priorities, the counties that you serve, and also the populations that you serve. If you have any questions, feel free to send us a message or view the instructions at the link below. Here's the agenda for today's call. We will have a presentation by Courtney Harris, and then at the end, we will have time for questions. So feel free to drop them in the chat box throughout the presentation today, or feel free to save them for the end and you can unmute your line. I am now pleased to introduce Courtney Harris, our speaker for today's webinar. Courtney joined Covering Wisconsin in 2021. She supports Covering Wisconsin's current outreach work and identifies and develops new opportunities to reach consumers throughout the state, with a special focus on serving communities most at risk for lack of coverage and access to care. This includes building and strengthening relationships with partner organizations and community leaders, and identifying mutually beneficial opportunities for partnership. Courtney comes to Covering Wisconsin with a background in social work and experience in program management, stakeholder engagement, and health and public health benefits policy. She holds a Master's of Social Work from UW-Madison and a Bachelor's of Science in Psychology from UT Austin. And with that, I will hand it over to you, Courtney. Thank you.
Good morning. Thank you all so much for having me. It is so nice to be here with the Cancer Collaborative. And to see so many familiar faces. I am just so excited and happy to be back with this group. So thank you very much for welcoming me. For those of you who don't know me, I also used to be a part of this great team, and so I have some background and context of cancer prevention and control that I'm hoping to kind of integrate throughout the talk today. But I am just so glad to be back in your presence and to have the opportunity to talk with you all about this really exciting topic. I know that many of you are already very familiar with Covering Wisconsin and kind of the work that we do and some of the policy that I'm going to be talking about today. But I hope that there are a few new things that I'll share that will be of interest to those of you who are really engaged and familiar with us already. But also, for anybody who is new to this work, I kind of walk through a lot of the basics to lay the groundwork. So, and we can definitely go back during questions and talk in more detail about anything that I don't go kind of far enough into the weeds on if you have questions. So with that, I will go ahead and get started. Let's see if I can get my slide to move. There we go. So skip through that picture since Alex already did that lovely introduction. So basically today, what I'm hoping to cover is just an introduction to Covering Wisconsin and free enrollment help. We work with a lot of different enrollment assistance groups throughout this state. I know there are Cancer Collaborative members that are enrollment assisters, and so I'm hoping to kind of highlight some of that work that is happening across the state. Talk through just a really brief overview of some of health insurance options in Wisconsin, not to kind of reiterate information that you all already know, but just more in the context of enrollment assistance and kind of how that relates to the work that we do. And then I'll talk about the American Rescue Plan Act and what has changed most recently and how that has impacted the the health insurance landscape in the state. And then talk about resources that Covering Wisconsin and our partner organizations provide, including some resources that we've worked on in the past with the Cancer Collaborative, and then end hopefully with just some opportunities for partnership, some ideas and strategies around how we can work together to further this work. So Covering Wisconsin. Covering Wisconsin is a nonprofit organization. We are housed at the University of Wisconsin in Madison, here in Madison. I am at my house, housed at my house right now, but we do serve statewide, and we have offices also out of Community Advocates in Milwaukee, and then a navigator stationed in Rock and Walworth County right now. And we, like I said, we partner with a collaborative of enrollment assistance groups throughout the state to provide direct service to consumers. And so we do serve statewide, and our mission is to help people in Wisconsin find and use health insurance coverage. And we do that in a few different ways. One is by doing things like this, doing outreach and kind of partner development and professional development and presentations to spread the word about health insurance options and different health insurance related topics and the work that we do. But also really importantly, we have a team of expert navigators on staff who provide direct assistance to consumers in finding health insurance coverage and navigating those options. So what a navigator does, a navigator is someone who is trained and certified to provide direct assistance with consumers on a number of different topics. First, kind of finding plans and financial help. So trying to consider what options are out there and what might be of most use to a consumer based on their individual health situation. They also help folks sign up for coverage through healthcare.gov, BadgerCare Plus, or Medicaid, but really are just here as a resource for any questions that folks have about health insurance coverage, whether that is, a small question or something much more complicated. Our navigators are trained and available to help folks navigate their entire kind of health insurance process from start to finish. And that includes things like resolving billing and coverage problems, including appeals, or helping folks navigate a situation where perhaps they are not eligible for certain types of coverage. We can help connect to community health centers, to free clinics, to programs that health systems and hospital systems have available to help folks pay for care. And when it comes to someone living with cancer and managing a chronic condition, we also often help folks think through kind of out-of-pocket spending and how that works with their health insurance coverage if they do have it, or what additional programs and assistance might be available through health systems locally to help folks navigate that situation. And these are, I kind of highlighted this from the perspective of navigators because Covering Wisconsin does receive a grant through the Centers for Medicare and Medicaid Services to be designated as the state's licensed navigator entity, but we do work with a number of other enrollment assisters throughout the state. And you may hear terms like certified application counselor or CAC, are also agents and brokers. And we work very closely with all of those types of assisters, especially those who are publicly available and who provide free assistance to consumers with the full spectrum of health insurance coverage options. But you can reach us in a number of different ways. So from a consumer perspective, we do work generally by appointment, but also are just available to answer questions over the phone. So I put both our Madison and Milwaukee phone numbers on the screen there of how folks can reach us directly. And we often actually have the same person answering both of those phone lines. So regardless of where you are in the state, if you call one of those phone numbers, you'll get connected with a navigator to answer questions or to set up an appointment for you. You also can work with a local enrollment assister group. There are many organizations throughout the state who are doing this type of enrollment assistance. For example, 16th Street in Milwaukee is one of our partners, 16th Street Community Health Center, who I know has been involved in the Cancer Collaborative as well. And they also provide enrollment assistance. And so you can also work with folks like that directly. And you can find your local enrollment assister either by calling Covering Wisconsin, we can help you find that group, or by calling 211, and we work with them to train them every year on the folks that are available and how to make referrals to the right type of enrollment assistance. And you can also schedule appointments directly online through our website. So if we have time at the end and folks are interested, I'm happy to take us to our website and kind of show you what that looks like and how you can schedule appointments online through our website as well. Now, just some of the policy and program information, which I know many of you know is kind of my favorite piece. I love to talk policy. So I'm going to skim through some of the basics and then really delve in deeper on some of the American Rescue Plan Act changes that are really relevant and exciting right now. But just wanted to highlight kind of overall, there are kind of these two publicly available health insurance options that navigators and enrollment assisters in Wisconsin really focus on primarily. And that is, of course, Badger Care Plus and the Medicaid program, but also healthcare.gov and the federal marketplace. And really what I wanted to highlight on this slide is just that there are kind of, there's a special opportunity for folks to enroll right now through August 15th. The marketplace was reopened back in February for a special enrollment period that is really functioning more like an open enrollment period where folks don't need to have a qualifying, life circumstance or a qualifying life event that qualifies them to enroll right now. Anybody can come into the marketplace right now and sign up for the first time or change their plan or update their information, which is really important, which I'll touch on in a little bit. From now until August 15th. So this is really a great opportunity for folks to kind of explore their options around coverage if they're not covered or they're not happy with their current coverage through August 15th. And that is for 2021 plans. So folks can sign up right now for coverage that they'll get the next month. But typically there is an open enrollment period, as you are probably familiar, at the end of each year for the next year's plan options. And there was recently, I think 2 weeks ago now, a proposed rule released to actually extend that enrollment period even longer this year, back to kind of this period that runs through the middle of January, more similar to what we had under the Obama administration at the end of their time in office. So just to kind of delve a little bit deeper in a couple of these, Badger Care Plus, I know many of you are very familiar with this program, but I did just want to highlight that since the kind of beginning of the pandemic, since March of 2020, because of the federal public health emergency, DHS has not been terminating coverage or ending coverage for anyone in these programs, even if their income or their household situation has changed. So there are, of course, some situations where folks may request to end their coverage, but or if they move out of state, something like that. But some of those typical situations where you would imagine someone losing Badger Care coverage during this time, to make sure that folks were able to maintain health insurance coverage through the pandemic, DHS has not been ending Medicaid coverage for any consumers. And that policy will extend through the end of the federal public health emergency. And at this point, we're thinking that the kind of renewal process will start again at the beginning of next calendar year. Let's see. Uh-oh. My slide won't flip. Uh-oh. Sorry, guys. Technical difficulties. Alex is helping me out.
Yeah, Alex will work on that quick for you.
Thank you. It's always something, right? My internet has been down most of this week, and so I was glad that at least came back up today, and hopefully that's not causing an issue.
For some reason, my screen seems to be stuck. I'm gonna try again.
Okay. Thank you for your patience, all. Oh, there you go.
Here we go. I'll just advance them for you now, Courtney.
Okay, sounds good. So I think I covered most of this already. The one thing I wanted to highlight on this slide of this other health insurance option through the marketplace is that almost everyone can purchase a plan through the marketplace, but financial help is based on income. And I'm really going to go kind of more in depth on that when we talk about the American Rescue Plan changes. So I won't delve in too deeply there. And I think we can go to the next slide then, Alex. Awesome. So as I mentioned kind of in the beginning, those are the two main health insurance, publicly available health insurance options that enrollment assisters work with, but we really are available to answer any question that folks might have about their coverage. So if someone is covered through their job, but they're not sure if there might be a better option for them out there. One thing I didn't mention about marketplace coverage is there is still an affordability employer affordability requirement, meaning if someone has an offer of what is considered affordable coverage through their employer for an individual plan, then no one in that household is eligible for financial help through the marketplace. So a lot of times you'll hear about what's called the family glitch, where an individual in a household might have a plan available to them through their employer that is around, they pay 9% of their income, or about almost close to 10% of their income or less per month for that plan. That is by the marketplace considered to be an affordable offer of coverage. And so that means not only that individual, but also their entire family is not eligible for financial help through the marketplace. But that's a really wonky situation. So a lot of times folks have that coverage through their job, but they may not be sure if they could qualify for another more affordable option through the marketplace. And that is a reason that someone could come and talk to a navigator. Also, if you're going through a transition, if maybe you are leaving your job and you might have an offer of COBRA, where you can continue your employer's plan, but maybe lose their contribution. There may be better, more affordable options for you through the marketplace during that time. I can tell you from experience that when you get your packet of COBRA information, they do mention that you have other options for coverage like through the marketplace, but it's buried in about 20, 30 pages of documentation, and that can be really complicated and something that folks often miss. Also, everyone's individual situation, of course, is different with health insurance coverage, especially for someone who may be a cancer survivor or in active treatment and is already spending a lot of out of pocket for their coverage. They're using healthcare a lot. They've already paid a lot towards their deductible or their out of pocket max for the year. For someone in that situation, it may make more financial sense to stay in that plan and to pay that higher premium and stick with their COBRA coverage instead of switching plans at that point when they would have to start paying out of pocket again for coverage towards their deductible. So those are the sorts of kind of complicated, individually based situations that a navigator and enrollment assister can help walk someone through. The one piece on this slide that I wanted to highlight too is that in Medicare, so our navigators are not licensed to provide direct application assistance with Medicare, but we do have very good connections with our local aging and disability resource centers who have staff on site and that work with them who can provide that sort of application assistance for Medicare. So if folks have general questions about Medicare, if they might be eligible, we can definitely do our best to answer them, but also we'll make a referral to an ADRC for more detailed help. All right, thanks, Alex. All right, now the fun stuff. So the American Rescue Plan Act and the COVID relief law that was passed in March and implemented earlier this spring was really a game changer. And this is what we're really trying to get out the word about right now. This was the Biden administration's kind of first go at trying to fill in some of the gaps in healthcare.gov and in the marketplaces that were left when the ACA was first rolled out. And really trying to make this option in the marketplace more affordable for a lot more people in this country. It did that in a number of different ways that I'll go in more detail about, but primarily by increasing financial help or those tax credits that go to help reduce monthly premium costs for everybody who was previously eligible in the marketplace. So across income scales, everyone's premiums have been reduced thanks to this American Rescue Plan Act. It also really significantly for folks at the lower end of the income scale, created an option where $0 monthly plans are available for anyone with a household income of less than 150% of the poverty level for the first time. And so this is a big difference. There may have been folks at this income level in the past who could have qualified for bronze plans or plans with higher deductibles and out-of-pocket costs for free. But with this change, anybody in this income range can now qualify for a plan with additional cost savings to lower their out-of-pocket costs. And they could purchase a silver plan now for $0 a month. It also eliminated this kind of income cliff at the middle end of the income scale. So previously at 400% of the poverty level, you lost eligibility for any subsidy through the marketplace. And now based on kind of how income-based financial help is calculated, folks at this higher end of the income scale now could qualify for financial help through the marketplaces. And then really significantly, this just made the headlines recently because it was passed earlier this spring, but just implemented on July 1st. Folks who have received unemployment compensation or unemployment benefits at any time this year qualify for extra financial help for plans in 2021. So I'll talk about that a little bit more in detail too. But because of all these changes, we're really considering or really asking folks to take another look at the marketplace if they've looked before and not been able to find something that's affordable, or if they're currently enrolled, we're encouraging them to come back and update their information to get these new subsidies. Go ahead, Alex. Thank you. And then a couple of things I just wanted to mention. There are several other things included in this law, which I'll touch on. There is a free COBRA option available through September for some folks who have been laid off or had their job hours reduced. There's also some health coverage related tax relief for this past tax year. So folks who normally may have had to repay some of their tax credit if their income went up during the year, did not have to repay that excess tax credit for this past tax year. And then, of course, there are some new Medicaid state options, which I'm happy to talk more about if it's of interest to this group. But it did create an option to extend postpartum Medicaid coverage through a full 12 months, and then provided extra incentives to expand Medicaid. At this point, the state legislature has not taken up either of those options, but it is something that is available under this law. All right, so just to explain a little bit more about how this American Rescue Plan Act really changed premiums in the marketplaces. How financial help in the marketplace is calculated is based on a required premium contribution percentage. So a consumer's household income, the marketplace takes a look at that income and says, based on where you fall in the federal poverty level scale, here is the percent of your income that you're required to contribute towards a monthly premium. As you can see, this current law should say, under the ACA as written, this was the required premium contribution percentage, and the American Rescue Plan Act lowered that across the board, which means that folks are required to pay less monthly for their premiums, and tax credits make up more of the cost. So what that means is across the income range, premiums have been reduced, and significantly for folks in that 150% or lower income range, they now have a 0% premium contribution percentage, meaning those benchmark or silver plans are available now for folks in that income range for $0. And then of course that cap at the top has been removed. And so for folks at the higher end of the income scale, they now just have to pay a percentage of their income towards a premium. So if a benchmark plan or a silver plan in the marketplace is available, but would cost more than 8.5% of that family's income, then they are now eligible for a tax credit and can get a reduction on their monthly premium to make it less expensive for them. And then this change that was just implemented in July for folks receiving unemployment compensation, how this works is that anyone who has received or been approved to receive unemployment benefits at any point in 2021 has their income capped at 133% of the poverty level, regardless of their actual income for the year. So if someone, has lost their job, received unemployment compensation for a portion of the year, but maybe then was able to find another job, started making some additional money, and their income has gone up, the marketplace will still cap their income for this year, for 2021, at 133% of the poverty level, which means that anyone who has received unemployment benefits this year are eligible for that $0 benchmark or silver plan with extra savings to reduce out-of-pocket costs. There is a caveat, of course. There are tobacco surcharges on plans. So if someone indicates that they are a tobacco user, plans across the state do charge a surcharge then on top of that, that premium. So folks in that situation would have something they have to pay for their monthly premium still in Wisconsin. And then just a couple of kind of quick FAQs about the marketplace. What this all means, since it exists both for current marketplace consumers and folks who sign up for the first time, is that we really, across the board, want folks to come back to the marketplace and take a look at their options. If you come back into the marketplace, whether you've gotten unemployment benefits or you just want to take advantage of these additional subsidies, and you update your information in the marketplace, especially if you do so before August 15th, you can update and get that new premium. But if you do so before August 15th, you can also change your plan for the rest of the year, which means you could qualify and find a plan with a lower out-of-pocket maximum or a lower deductible for the year, a more comprehensive plan, for example, through the marketplace. And then the next question that we often get in is really applicable to folks who may, like I said, be using a lot of healthcare services and have already paid a lot of out-of-pocket costs towards their deductible. Many of the plans in Wisconsin did take advantage of the option to roll over folks' out-of-pocket costs that they've already spent. So if someone sees stays with that same health insurer, so let's say they have a plan with Aspirus, for example, and they want to stay with Aspirus, but they see a plan that they could, that would have a lower deductible or out-of-pocket costs for the year, that might be a lower monthly premium for them. They can switch to that plan, and what they've already paid out of pocket for the year towards their deductible would carry over to that new plan. That doesn't happen across the board. It really depends on the plan, but it is a good option for folks. So we just want to make sure people are aware that even if you do utilize a lot of healthcare services and you've already paid towards that deductible, that doesn't necessarily mean that you don't still want to come back in and take a look at your choices. But again, this is a more complicated situation and something that folks might want to work with a navigator or other enrollment assister to kind of consider their options and figure out what might be best for them. And then I'm just going to touch on this because this is kind of a really wonky change, but the law did provide an option for free COBRA coverage through a tax credit to employers just for a limited time. So from April of 2021 through September of 2021, if folks lost their job or had their hours reduced, and that's why they're eligible for COBRA, they may be eligible for the government to subsidize that premium instead of their employer, and for COBRA to be then a free option for them. Folks who were eligible for this were supposed to have been notified by June 1st, and it applied both to folks who are enrolled in COBRA and may just be able to get their premium covered, or people who did not choose to enroll in COBRA originally because it was possibly too expensive for them to pay the whole premium. It does give them the option to enroll in COBRA and backdate that coverage to April 1st of 2021 if they'd like. So happy to answer more questions about that, but if you do have folks in this situation who had lost their jobs, had their hours cut, because they have this option potentially, but also this option through the marketplace if they got unemployment benefits. Another really good opportunity to connect someone with an enrollment assistor to talk through their options. And then one question we did get about COBRA kind of related to this is because that's a limited time option just through September, if there will be an opportunity then for folks who maybe choose to enroll in COBRA, especially for folks who may have chosen to stick with COBRA because they had already paid a lot towards their deductible. They can, if they lose their premium subsidy at the end of this free COBRA period in September, if they want to switch to a healthcare.gov plan at that time, they can do so. CMS has clarified that there is a special enrollment period where folks can enroll in a marketplace plan at that time. But out-of-pocket costs if they switch to that new plan would not roll over. So again, just another kind of more nuanced situation that would be really helpful to connect someone with an enrollment assistor to walk through if they have questions. And then I just wanted to highlight, I'm not going to kind of walk through and read all of these to you all, but we do have just some key messages that we're trying to get out to consumers just to kind of simplify and highlight the really key messages of all of that wonky policy information that is most important for people to know. And it's really highlighting that now is the time to look again. So the marketplace is reopened. You don't have to wait till the end of this year. You should come back. You should look again at plans right now if you're not covered and you have an opportunity to change your current plan. So now through August 15th is really that time. We're also really trying to highlight for folks that this is, the marketplaces have changed, that the prices are significantly lower now than they have been in the past. So I know many folks have looked at the marketplace and just not found affordable options for them in the past, whether that be premium wise or because deductibles and out-of-pocket costs were too high. Now is the time to come back and take another look because there are more affordable options available now than there have been in the past. And then again, really trying to get out this message that there is free help available. Covering Wisconsin and enrollment assisters have been available since the ACA rolled out in 2014, but not enough people know that we exist, that we're out there, and that this is free help for consumers to walk through their individual situations. Everybody's healthcare situation, as you all know, is extremely personal and individualized, and it's impossible to spread a message that relates to everyone. And so what we really try and emphasize is that there are folks available in the community to talk with you about your individual situation and what might work for you. And that help is free. And you can find them by calling 211 or by going to Wiscovered, which I hadn't mentioned yet, but is kind of a statewide address that gives folks a little bit more background information on all of these health insurance options, but also connects to our website at Covering Wisconsin to have folks sign up with an enrollment assistor locally. And then the only kind of message I wanted to highlight on this page, or I guess two of them, one is that a lot of times folks who are going through these coverage transitions, myself included, I recently went through a health coverage transition and I wasn't sure what to do. I just needed something for a couple of months. We really try and help people feel comfortable just talking with someone and finding an option for them for right now. You can sign up for things like Badger Care and Medicaid or for the marketplace just to get you through a period of transition. You can sign up and you can cancel it at any time if you need to. It's not something that you're locked into. And so even if you're just just going through that coverage period, if you have a break in income, don't hesitate to pursue some option to just get you through that period. And then spreading the word. Word of mouth is really how most folks get to Covering Wisconsin when we ask. And so we are encouraging both consumers and partners like you all to just help us spread the word, to let people know that these options are available and that this free help is available in the community for folks who have questions. All right, and then some of our resources. Covering Wisconsin has a health insurance literacy team that works to create consumer tested and really digestible, consumer friendly materials on a lot of these topics. So I have health insurance options on the screen, which is one that's really popular and walks through a lot of what I talked about. But we also have Badger Care Basics and lots of other key topics, how to use telehealth, lots of different resources available in our Learn section of our website, both in English and Spanish. And those are materials that we often partner with groups like with the Cancer Collaborative to produce, which I'll talk about next. We also have an ARPA, or American Rescue Plan Act, fact sheet that talks through, again, in more consumer-friendly language, what changed, what is different right now, some of those key points, what folks need to do, whether they have a plan right now or they're currently uncovered, and then how they can find free help. And those also are available in black and white and color, in Spanish and English on our website. And then I did, of course, want to mention the how-to sheets that we partnered with the Cancer Collaborative to create. So on the Cancer Collaborative website, there are how-to sheets on a number of cancer-specific topics focused primarily on prevention and screening. I have the colon cancer sheet on the screen here. I think, and the team will have to correct me at the end if I'm wrong, but I think we kind of had a little snafu with getting the correct version on the website of the one that had the new logo of the Cancer Collaborative and the new guidelines, but I'm hoping that we either have resolved that or can get it resolved soon. I know Stephanie and our communications team are working on getting that one updated, but those are available in English and Spanish. And we also have a choosing and using health insurance how-to sheet on the Covering Wisconsin website, both specific to folks who are living with cancer and walking through some of these individualized situations and kind of looking more comprehensively at all of the costs associated with a plan, looking at out-of-pocket costs in addition to premium costs, and then some additional resources that are available to kind of provide that wraparound support to survivors, things through the American Cancer Society, Center for Patient Partnerships, and things like that. So another kind of partner resource that we worked on together. And I did want to highlight, we just have the cancer sheet available in English, but we have a very, very similar sheet on choosing and using a health insurance plan when living with a chronic condition. And we have that one available in both English and Spanish on our how-to sheet page from the previous slide. And then outreach and promotional materials. So we do also have a toolkit, and thank you, Carrie, very much for sharing it in the newsletter that went out today. I was excited to see that. We have a toolkit of materials. We develop a new one every year for open enrollment, but also have one just for this special enrollment period right now, highlighting some of the changes from the American Rescue Plan Act. We have materials in both Spanish and English, and they are kind of in a few different formats. You can download just social media graphics, but we also have outreach cards and flyers that can be printed and personalized. So I'll mention this again at the end, but they can be tailored to include local enrollment assistance information. If you feel like there's a message or an image that would resonate more closely with your community, please reach out to me, and we are always interested in kind of co-creating and tailoring materials in the toolkit. We also have our partners at the Office of Commissioner of Insurance have a toolkit as well that's primarily focused on social media, but does have images and messages in Spanish, English, and Hmong as well. And then I also wanted to just mention, in terms of social media marketing and spreading the word, if you all have social media accounts at your organizations and are interested in helping to get out the word about these new options and how to find local enrollment assistance, Covering Wisconsin and all of the partners you see here on the screen are always posting new content and information in often in English and Spanish on our social media accounts in Facebook and Twitter. And it's just an easy way to kind of continue to spread the word and help amplify our messages. We do a lot of kind of paid boosting of our social media, and the more folks we have engaging with those posts before we do that paid boost, the farther they go and the more consumers they can reach. So I would be remiss if I did not ask you all to follow us and, and start sharing that information as well. All right, and then I've really wanted to spend some time focusing on this, and I'm hoping we can have some Q&A on this too, or follow-up conversations, but wanted to kind of just highlight some ideas and strategies for continued partnership with our cancer prevention and control partners by kind of walking through my perspective of how important you all are to this process based on my own experience and thoughts on this. So of course, the Cancer Collaborative itself, and then all of you as members are incredibly trusted sources of information with your consumers and folks you work with, and with other professionals across the state. And so when you are sharing this information, when you are contextualizing it for your audience, it really means a lot more. And the message spreads farther and wider. So we appreciate any of your support in just continuing to spread the word with your patients, with the consumers that you're working with your friends and family and neighbors, but also with other professionals in your networks. You also can play a really key role in connecting consumers to free and local enrollment help. I know that many of you are working with folks on a daily basis, and they may have questions about their health insurance coverage situation and may just not know that there's someone that is local in their community that can help them through that process for free. Our navigators are compassionate folks. They are people that are really passionate about this work, and they care about their consumers. And so it's really meaningful to connect to someone who has the time and expertise to sit down and really work individually with a consumer. You also have really key insights and experience that can make this information about health insurance coverage a relatively complicated and boring topic much more relevant to your audience. So you can help folks understand the connection between health insurance coverage and free preventive care and HPV vaccines and tobacco cessation coverage and these really key topics that you may be experts in and you may really see the value of. You can help folks see the connection between what you're working on and what is important to them from the perspective of their own health and health insurance coverage. And then on kind of that similar front, you're obviously also really key partners in co-creating and tailoring materials. When it comes to things like our toolkit, one of the things we've found is that, of course, those messages and that information resonates more locally if it comes from a recognized source. So if your organization wants to have outreach cards or flyers at your organization, but you're maybe interested in co-branding and including your logo on them, your local contact information. If you have enrollment assisters on staff, please reach out to me and we can work with you to do that. We often do co-branding and tailoring of those materials and can also help with printing if you need. And then, of course, for my policy folks, you can help inform policymakers on key issues. So you can help, again, draw the connection between cancer prevention and control and health insurance coverage. And when topics come up on things like Medicaid expansion or state support for enrollment assistance, there's a component of the governor's budget that would have put some state funding behind enrollment assistance efforts in our state. And it didn't make it through to the final budget. We just don't have enough folks that are kind of talking about, from a policy perspective, why the marketplace and health coverage options, but also this type of enrollment assistance is important. So, those of you who have those connections to educate and inform policymakers can also have an impact there. And then what Covering Wisconsin can provide, I already highlighted a lot of this, but of course we have our staff who can provide free and local help from navigators. We have these free promotional materials and other resources and including consumer tested how-to sheets on cancer prevention and control and other health insurance related topics that can be tailored and used locally. And then we do trainings like this and others for professionals and also educational sessions for consumers. So our navigators often do kind of enrollment events where they'll go out and set up a table or participate in a partner event and share information and be there to answer questions. And they also do presentations as well for the public, for consumers, to break down some of these concepts and share options with folks. So if anyone is interested in having me or one of our staff come out and talk to your organization, I would love to have that conversation, even if you're just interested in learning more about this and trying to figure out how we could work together to spread the word about health insurance coverage, to connect your consumers with our services. Please reach out to me, and I would love to have a conversation and figure out what we could do to partner moving forward. And then I just highlighted again kind of how to refer to an enrollment assister, both our phone numbers and then our tool. But I think that will wrap up everything that I was hoping to share. Yes, great. So hopefully we do have some time for questions too. And then I included both my email address. As Amy knows, I don't yet have a work phone number, and so people at UW think my phone number is Amy's phone number at this point, but my email address is the right way to get a hold of me right now, and I would love to talk with you more if you have questions or just want to talk about partnership. But you also can contact Covering Wisconsin directly if you have a consumer who wants more information. If you want to talk to a navigator, I put our Madison number on the screen, but you can reach us at either the Madison or Milwaukee numbers you'll see in the slides and on our website. We do also have a policy summary that's a little bit more detailed from kind of a professional perspective of the changes in the American Rescue Plan Act. I included the link there. We are also in the process of updating that document, and there will be a new link, unfortunately. So I will work with the team to figure out how we can get out the new link to folks once we do update that document. And I think that's it. So are there any questions? I didn't see anything come in yet, but I am more than happy to talk through any questions that you might have. I know that was a lot of information, so thank you for letting me talk at you for 45 minutes.
Thanks so much, Courtney. That was a really great presentation. And so now we have some time for questions, and I'll hand it over to Beth to facilitate if anyone wants to drop them in the chat box, or feel free to come off of mute and ask them as well.
Great, thank you, Alex. And thank you, Courtney. That was great information and so overwhelming. So in a sense that it's so nice that there is help out there for people. Just that you can get an enrollment assister to really walk through any of these questions, because it can be so overwhelming. I have a question. So with the enrollment, I would say not just the enrollment assisters, but the program in general. Do you have a lot of questions that come in just about why should I get health insurance? Because, you know, it seems like you're able to help people, but I'm also wondering if there's that need to just encourage people the benefits of having this more comprehensive health insurance coverage.
Yes, absolutely. That is a great question. And we do get that a lot. And I think that's something that our navigators really emphasize, especially when they're doing those kind of educational sessions in the community too. And something that we could probably do a better job of highlighting with professionals too. One of the things that we really try and highlight is kind of the fact that these are quality insurance plans and what that looks like. So what is covered? Free preventive care is something that I think we really try and emphasize, the essential health benefits and things like cancer screenings and these other really important preventive health benefits that you can get access to through health insurance coverage, whether that's healthcare.gov or Badger Care, without paying anything out of pocket. I think a lot of the disappointment around health insurance comes in when you are paying for this plan and then you go to the doctor and you still have a bill. And so working through those billing issues is definitely something that our navigators do, but we also try and emphasize some of the services that you can get free of charge. We have a what's free how-to sheet that we reference a lot from the perspective of the preventive care. And I also think we could do a better job of talking through kind of, health insurance is complicated and it gets really confusing, but kind of the negotiated rates that folks get when you work with an insurance company. So the prices that you pay out of pocket if you don't have coverage versus, if you do have coverage, are different. And so we try and talk a little bit about just kind of the benefit of having coverage in case of an emergency and that negotiated rate process too. But that gets a lot more complicated. So the preventive care piece is one thing we really try and emphasize.
Yeah, that's great. Because you're right. Health insurance is so complicated once you have it, and trying to figure out billing and why do you get bills and why are you paying because you go, but sometimes you don't. So that's great. Super helpful resources to know that are available. We did have a question come in that with regard to colorectal cancer screening, is there any process at the state legislature level to cover a follow-up colonoscopy after a positive colorectal cancer screening test? So I don't know if you know this, or if this is something we need to kick over to our policy team, but just let me know, Courtney.
Yeah, I actually would love to hear. This was an issue we were following really closely when I was at the Cancer Collaborative. So I would I think there's been some progress, but I don't want to speak it's been a while. So I will let Amy.
Yeah, I'll see if Amy or anybody on the team here can help us out.
There's been no progress to date. Right now, the focus has been on the budget and some committee work, but as far as measurable improvement toward that goal, not that I know of. Courtney, did you have some other intel?
I thought there was something, maybe I'm thinking of Medicare. I know there was on the federal level some.
Yes.
I think Tammy Baldwin had introduced a bill, right, around Medicare and closing that loophole.
The loophole in Medicare was closed on the federal level, but nothing on the state.
Okay, that must have been what I was thinking of. Thanks, Amy.
So I believe the issue here,
and an example of the type of kind of policy-related issue that is just so clear to folks in this field as a need. But that we don't necessarily have all of the right voices articulating that to our policymakers about why it's important and the impact that a change like that could have.
Paul Westrick, we'd love to hear from you.
Welcome back, Courtney.
Hello, Paul. It's so nice to see you.
And congratulations, Beth, on your appointment. So, Courtney, just a sort of a stepping back in your new role, who are the uninsured in Wisconsin? The data that I see, I think, go back to like a 2019 survey, and so much has changed. But either based on the people you serve, the volume of what's happened over the past year, do you have a sense of the characteristics of the uninsured in Wisconsin?
Yeah, of course you're going to ask me a data question, Paul. It's such a great and relevant question, and I don't have a great answer for you off the top of my head, but I could definitely take it back and share some more details with this group of kind of the true statistics. I think, one of the things that we've seen in the data year after year in Wisconsin, and one of the things that we try and get out as an organization, is that a lot of folks in Wisconsin have been eligible for coverage, but not insured to this point. So that's, folks who are eligible for Badger Care and Medicaid and haven't enrolled, or are eligible for coverage through the marketplace and are not enrolled, partially on that marketplace side because of an affordability issue. They couldn't afford to pay those premium costs. They also couldn't afford to pay the out-of-pocket costs once they get enrolled into a marketplace plan. And so I think the American Rescue Plan goes a little bit of the way on the marketplace side in terms of making that more affordable for folks. But there's definitely more work to be done there, especially for folks in that lower income bracket who may now have access to those plans that are, $0 monthly premium and have that cost sharing change, but these are folks who, you know, paying for even if you have a low deductible meaning something like $250, if you go to the doctor's office and you get a bill for $100, that's a really large expense for someone that's, you know, making just over the poverty line. And these are folks that could potentially be covered in a Medicaid expansion, where a Medicaid, you know, copay of $3 might be a little bit more feasible for folks. So unfortunately, there are still a lot of folks in our state who are kind of in this coverage gap, in the sense that they are eligible for coverage, but they may just not be able to, they may not be able to afford it, or they may just need some help from an enrollment assistance group in figuring out what their best option is. So I do know that we do continue to see that in the data, but in terms of kind of particular populations and some more of that data, I know we have on a statewide level at least, and in some perspectives on a county level, data that breaks down further by income range and some demographic features, and I could follow up with some of that information.
Great, thank you, Paul. Thank you, Courtney. Any additional questions for Courtney? All right, well, thank you, Courtney. I'll turn it back over to Alex to close us out.
Thank you, everybody.
All right, just to wrap up here, we will have a poll pop up shortly, but this is just highlighting those how-to sheets that Courtney talked about earlier. The link to them is below at our website. There's a number of different ones, so feel free to check those out. And then next month, our webinar on August 12th will focus on financial toxicity. So registration for that is open now, so you can do so at the link below. And then I will launch the poll. Hopefully, here we go. So thank you all so much for attending today, and we will see you next month.